Dealing with eczema can be very frustrating. Eczema is a condition that shows up as red, flaky, thinner, thick plaques on the skin. Any area of the body can be involved from head to toe, but the most common parts where eczema shows up are the arms, the legs, sometimes the torso, and the face, especially in younger children. My name is Dr. Yuval Bibi. I'm known as the Rogue Dermatologist, and today I want to talk to you about how to deal with your eczema from A to Z. So let's start with the first thing, which is do no harm. Let's discuss eczema very briefly. Eczema is a common skin condition that affects millions of people. The condition itself develops on dry, sensitive skin, and that means that making the skin drier or more irritated is something that can make your eczema worse. So what do? Don't make your skin drier, don't irritate your skin. Avoid things like hot water, long showers. Avoid soaping over areas that don't need to be soaped. Specifically, areas that should be soaped are areas that produce body odor under the skin folds. But most of the rest of the skin does not need to be soaped or cleansed, as soaping or cleansing can actually make the skin drier, more sensitive, and therefore more prone to developing eczema. Also, avoid using physically abrasive devices on the skin like washcloths, scrubs, exfoliants, loofahs, washcloths, and so on and so forth. These things will surely irritate your skin physically and will make your eczema worse. Now, what can you do to help things along? Well, first of all, be good about moisturizing your skin. The best moisturizers out there are the occlusive types, meaning things like white petroleum jelly or shea butter balm. However, there are moisturizers that work quite well for eczema, maybe not as well as petroleum jelly, but they're still in the game, such as Aquaphor Healing Ointment or CeraVe Healing Ointment, for example. Those are not as good as pure petroleum jelly, but they do contain white petroleum jelly as their active ingredient. So if you like the texture better, by all means use those as long as your skin can tolerate it. The trick is to use it as often as your skin needs for you to apply a moisturizer, meaning anytime it's dry or flaky or irritated or feels tight or you're not quite sure, this is a good time to apply a moisturizer. Keeping your home environment humidified is something very important, especially in dry climates or in dry home environments. So the Northeast, for example, in the winter, or Florida, surprising enough, year-round, the home environment is exceptionally dry because the South Florida home is air-conditioned 24/7. Room air is exceptionally dry, and that makes you lose more water to the room air. So, keeping a humidifier in your bedroom while you're asleep, especially around flare-ups or very dry seasons for you, is an excellent idea to stop water loss from the skin and maintain the integrity of your skin. Now let's talk treatments. Light treatment administered through a light box in the clinic or sometimes through a home device is an excellent treatment for eczema. The light being used usually is what we call narrowband ultraviolet light, or narrowband UVB for short. This is an extremely effective method of treating eczema safely. Obviously, watch out for sunburns, but the best and most effective way to do this is go to a dermatology clinic, get your treatment calibrated so you don't burn yourself, get your eczema under control, and then possibly opt for the home device, for which some insurances actually float the bill. The one thing about the narrowband UVB or light treatment is that initially it requires a lot of frequent visits to the clinic. They're very short visits, but you will be coming into the clinic about 2 or 3 times a week for the first few months until your eczema is under control. So that is something to consider. Next are the topical medications. The possibilities for topical treatments for eczema have exploded over the past few years. It starts with topical steroids, which are extremely effective, especially if used appropriately, not to go overboard with them, meaning you apply the medications twice a day, and obviously check with your dermatologist what's the best medication to apply and how long can you use it. But the trick is to use the medication to get things under control and then back away from the treatment so you don't run into side effects of steroids, which could be changes in the texture of the skin, as in skin thinning, changes in color of the skin, as in hypo or hyperpigmentation, and sometimes other side effects. Luckily enough, none of the side effects that occur with topical steroids are permanent or scarring, but they can definitely take a long time to reverse, so you're better off not getting into that territory in the first place and use your medication wisely. Next up, calcineurin inhibitors, which in the United States are known as Protopic or Elidel. These are pretty effective medications topically. They can sometimes induce a little bit of a burning sensation over the area. so be mindful of that. The burn is usually short-lasting, but those medications can be used safely over any area of the skin without causing any significant side effect as far as the texture or the color of the skin. Other topical medications include Eucrisa, crisaborole, Opzelura, ruxolitinib, which is a topical JAK inhibitor, tapinarof cream, which is another class of medication, or Cerave, otherwise known as roflumilast, which is another topical agent that was introduced recently into the market. Many of these agents are actually highly effective in controlling eczema with very few side effects to show for. The downside to a lot of these new medications is that they can be pretty pricey, but you can find ways around that by getting samples from your dermatologist or getting into a discount program. A lot of these are implemented by the pharmaceutical companies that are trying to usher those products into the market. So find your best product along with your dermatologist and put it to good work. Next up, if your eczema has not responded to topical medication, systemic medications are going to be your next choice. Systemic medications consist usually of the old school cytotoxic medications, and then there are the new generation of medications such as dupilumab, which is an injected biologic with very few side effects. There are some side effects to speak of, but most people do not run into them. And then there are the new pill form medications such as the JAK inhibitor category. With all these skincare approaches and medications, remember that the one goal in mind that you should have is controlling your eczema with the least amount of work possible. So do no harm, first of all. Take great care of your skin, being mindful to moisturize it consistently and not allow it to lose moisture, and stop moisture loss from the surface of the skin, and then treat your eczema with the best combination of medications that you and your dermatologist came up with, minding the time frame and the endpoint for the treatment, and making you your own boss so you know when to go back to the medication, when to back away from the treatment, and when to go see your dermatologist should things not respond in a timely fashion. If you've enjoyed this video, don't forget to hit the subscribe button. Also, don't forget to share and like this video. For more information about skincare and how to take care of your skin in the most cost-effective way possible, pick up my book, Six Skin, Skincare Made Simple, on Amazon.com, now available in audio. More great content coming your way right from this channel. Thanks for watching, and God bless.